Good morning, everyone. It's a pleasure to be here. Thank you for the warm welcome and for an excellent talk, Ron. It's a very difficult act, I have to say, to follow Ron, but I will do my best. So my name is Rebecca Porta. I'm the Chief Executive of the Urology Foundation. I was invited to speak this morning on catheters and UTIs associated with catheters. The first thing I did, of course, was to poll some of our urologists and our specialist nurses to say, help, what should I be talking about? And the key message that came out was, Rebecca, highlight, if nothing else, the importance of good hygiene. Keep the talk simple so that everybody can understand what we're talking about. And please, please talk about associated. So it's UTIs, associated catheter infection. That's a really, really important message. So hopefully there'll be some good takeaways for you. The session this morning is divided into two quite clear parts. So one is giving you an overview of UTIs, an overview of catheters and UTIs associated with catheters. Then I'm going to move into sharing two really good case studies from two different urologists. And then I really want to highlight the importance of bringing that urology team really early on into the program, into the discussions, because that is really key for today. And hopefully I will end with some good practical takeaways. I am not a medic, as Ron is, so today really is about practical information, guidance, and recapping for some of you on information you know, but hopefully there'll be some good takeaways. Without further ado, who we are and what we do. So the Urology Foundation. There we go. Urology Foundation, some of you will know who we are. For those of you who don't, we are a registered charity based in London. We work UK-wide. We are the only UK charity representing all urological disease, including cancers, bladder cancer, kidney cancer, prostate cancer, plus also non-malignant conditions such as kidney stones. Very often people come to us where they can't find information and resources elsewhere, such as in kidney stones. We invest in really groundbreaking, innovative research. We're committed to funding the best quality research, and we're looking at improved treatments and improved care. We're very proud of the fact that we were really one of the pioneers of robotic urological surgery, which is really obviously for many of you very important. We fund and support training and education programs, so that's right through from clinicians through to nurses, so do have a look at our website if you're interested in joining some of our programs. And we run awareness campaigns right throughout the year. Our big one is in September, which is Urology Awareness Month, and we work on a number of different areas and different campaigns. And finally, we work with a whole group of stakeholders to really raise awareness of urological diseases, to highlight the importance of what urological diseases are, and really to sort of help drive awareness and support for patients, ultimately their families and their carers. This is a cartoon that somebody shared with me, which I thought was really quite amusing. And basically, it really highlights the pain and the misery and the distress that UTIs can actually cause, not least of all within the hospital setting. And today, I am going to cover both the hospital setting and patients within the community setting as well. A bit of an overview on UTIs. So as many of you will know, the urinary system involves this area. There's a number of different functions within those individual organs, but collectively, these organs are responsible for getting waste out of the system. So that's really key today. The sorts of UTIs that you'll often hear about and people talk about and patients talk about are cystitis, which is very, very common, inflammation of the bladder, and over 50% of women will be talking about having a UTI at some point in their lifetime. And there are other UTIs as well, but the key one, I think, for this is cystitis. A lot of women will be complaining about cystitis and the impact it has on their lives. We were very, very pleased that actually the NHS has announced a real focus on UTIs going forward. And one of the key takeaways that a urologist said to me was, Rebecca, if you achieve nothing else this morning, please remind patients that if they have 3 or more UTIs, that they should be asking their GP to be referred onto a specialist. So a key takeaway from one of our urologists. So catheter-associated UTIs, I've underlined associated because one of the things that came out very sort of loud and clear when we polled our urologists and nurses is that it's not the catheter that is responsible for the infection, it's how people are managing the catheter that is responsible for that. And I think that's key. I think one of the confusions patients have is they think, I've got a catheter, I'm going to have an infection. It is about the care and the management of the catheter that is really, really key. So do try to emphasize that to any of your patients. As many of you will know, UTIs account for about 23% of all infections. That's about 1 in 5 patients, so it is very, very high. The majority of hospital UTIs or acquired UTIs are associated with catheter use, so it is really, really high. And there's been a lot of research done around this. One of the huge challenges that people will find in the hospital setting in particular is that UTIs can be really difficult to diagnose. This is particularly noticeable in older patients where they may have other illnesses or where they may be very challenged in terms of articulating their illness as well. But it is certainly a challenge. And one of the things I wanted to do was highlight some of the common symptoms that you should be on the lookout for with infection associated with UTI, with catheters. The ones that really come out and that we hear a lot around are this sort of sense of a high temperature, feeling unwell generally, having flu. That really is one of the things that people most often talk about. Urine odor as well, a lot of patients talk to us about. Mental confusion, again, the huge challenge that some of you will have come across is around patients who have dementia or who may have been admitted to hospital with other illness, but those are the key symptoms. So what are some of the causes? So a number of our urologists sort of fed into this particular session. Obviously what happens is that bacteria gets into the system and then goes into the bladder via the catheter. An infection can often cause during catheterization. So you'll see here there are 5 key points around that. The thing to really be on the lookout for is around hygiene, making sure that the catheter is regularly cleaned, regularly cared for is really key. There can be cases, particularly if there's a kink in the system where urine will go back into the bladder, so that is a cause of infection, and again, one of the things that we highlight. Bacteria from bowel movement is key as well to note in that. And one of the problems that you, again, will have in patients possibly with dementia or older patients is just the issues around hygiene as well. So, you know, cleaning from back to front as opposed to front to back. So there are some issues around hygiene there. Drainage is a key issue, and I'm going to be talking about treatment and management in a moment. And obviously that catheter being inserted, you know, good hygiene, washing hands is really key. So just a recap for some of you on the NICE guidelines. I think many of you will be aware of this if you're in the hospital setting. Really important to remove or change the catheter, and NICE do recommend removal where at all possible. Offer antibiotics, and I'm going to talk about the antibiotic importance in a moment. And really managing system through self-care, so really making sure that any of your patients, if they have a catheter for the first time, they have their catheter passport given to them, and that they're really managing and monitoring their symptoms, and they're on the lookout for warning red sort of flag symptoms. One of the things around antibiotics is to make sure that when you take the urine sample, that it is not taken from the catheter bag. That was highlighted by a number of urologists, and I think that's where some common issues can happen. And also that the antibiotic choice is reviewed as you go along. So depending on the results that you do, make sure that there is a review of the system. For any patients who are in a hospital setting, that you get them to the hospital as quickly as possible. Ron rightly talked about sepsis, and I think in about the second or third presentation that he gave on his slides, he talked about UTIs being really high up there, so really key to get patients to hospital really quickly. And also, I think if you're finding that you have a patient with a catheter who is regularly getting infections, regularly having to see the GP, that you actually take action, that you do something about it early on rather than letting it go on. So this can include referral to a urologist, making sure that some basic things such as not allowing the patient to get dehydrated is really important, and also monitoring their antibiotics as well. So just to recap, there are 5 key takeaways in terms of treatment. One is to remove, ideally, the catheter or to change the catheter. In doing so, obviously making sure that good hygiene practice is followed. Secondly, antibiotics. That antibiotics are given as soon as possible, and also that they are regularly reviewed. And if there are a number of situations where antibiotics are given, that you think about a referral. Self-care is absolutely key. The good thing, obviously, as many of you will know about the patient passport, is that passport allows patients and their families to take control, to be proactive in terms of their treatment. Hospitalization, don't delay if you're worried about a particular patient. Flu-like symptoms, cold, shivery, loss of sort of mental well-being, and that you review regularly. That's really key. And the review should really involve the urology team as well. So a few pointers here. We've got 6 key pointers on reducing and preventing infections. Some of them I've already covered, but the key ones I just highlight in here is daily catheter care. I can't emphasize enough good hygiene, daily care, making sure there's no leakage. The other point I would raise here, and it's important for the patient to understand this as well, is making sure that the drainage bag is below the bladder. This is something that is really, really key, and that is emptied several times during the day. Make sure there are no kinks in the tube. That is one of the key highlights when you look at how you overcome some of the challenges of a blocked catheter. Obviously, kinks in the tube are key. And also making sure that you consider removing or changing the bag as well. Important, if you can, to change the bag at least once a month. Self-care, so this ties in very well to the patient passport, and it would be interesting to know how many of you have patients who maintain and look after their patient passport. But there are some key things here for patients within these 10 points. One is practicing good hygiene, so making sure that it's clean, making sure that they use soap and water. I think one of the things around the pandemic is people are much more aware now of the need to sort of wash hands, use sanitizers, but good hygiene is absolutely key in preventing UTIs associated with catheter. Keeping patients well hydrated, keeping yourself well hydrated is really important. Bladder spasms, they are rare, but they certainly are something that you should be on the lookout for as a patient and require some pretty immediate action. And also if there are other possible signs of infections, such as feeling unwell, feeling fatigued. Somebody who I know, her husband regularly talks about feeling very unwell, generally very tired, wanting to stay in bed and having a temperature, so be on the lookout for those. Get help if there's blood in your pee, that's quite important, although also be aware that it may not be linked to an infection. And seek help, obviously, if the catheter falls out. So why should we, coming back to the very question we were asking about joining the dots and involving the urology team, why should we involve the urology team, the urologist, the specialist nurse? And I think this sums it up. This is really one of the key quotes that came through from our urologists. So I've got 2 case studies to share with you, which were provided by 2 different urologists. Patient A, and this is posed by models as opposed to particular patients. Patient A had long-term urinary retention and ended up in hospital on several occasions. Very frustrating, very worrying for his family. The final stay was really lengthy, and during that time, he was able to see a urologist, which is really, really key. And the key outcome here was the urologist was able to look at what was actually happening. Did this person, for example, need a catheter? Were there other alternatives? And I think the second point there, which is the urological investigation, was really key. There may be occasions when the catheter is not needed, or where there can be different options to catheterization. In this case, procedure or looking at how you can actually manage the obstruction and manage bladder emptying as well were key. The second patient was a woman who had an indwelling catheter. Quite an interesting, if not challenging, time for this particular individual. Many visits to the GP, and one of the things that we often hear about, just UTIs alone, not linked to a catheter, is just the frustration that patients have and where they feel that the GP is not taking their UTI seriously. And again, one of the takeaways for today should be that any patients who have regular UTI issues go to the GP. After 3, they should be referred on to urologist. But certainly this particular lady was visiting her GP, was very concerned about the number of infections that she had. And again, she was able through the referral to see a urologist and to be reassessed for actually, was it the right catheter? Did she need a catheter? And what were the other options generally available to her? And really, for this particular patient, they were pretty life-changing in terms of giving her quality of life back and allowing her to get on with the things that she wanted to. Some of the quotes that we've had around UTIs associated with catheter. I've highlighted the catheter passport there because we do hear cases where patients don't follow or have their catheter passport issued. That was, as many of you will know, issued in 2010. And it's really key, I think, that patients monitor that and they really understand it's a way of being able to manage and to monitor and have some self-control over their general health care. Again, one of the things we often hear is, the urologist wants to be engaged really early on. So patients come in through A&E, and it's very frustrating in some cases that they will see the patient 2 or 3 times after they've been admitted to hospital. I included the centre quote there because actually you often hear patients' family members talking about, just prescribe something, just give us another dose of antibiotics, my nan's unwell, my dad's unwell. That's not always the solution. Sometimes the solution should be that the GP refers on to a urologist. And actually you can see the quote in the sort of far left-hand corner there is that sense that the urologist gives some reassurance that there are different options. So when do you call in the urology team? I think 4 very good reasons as to when you should call them in. Worried about the infection, obviously, how you need to reassess somebody if they're constantly being readmitted or if their condition doesn't improve after antibiotics or previous antibiotics just don't work, where, as I said, highlighting repeat admissions to hospital. And joining the dots. I think this is really, really key. And one of the things I hope that the 2 case studies have really briefly highlighted is the importance and the benefit of people being able to see and talk to the urologist really makes. So in terms of benefits of having the urologist or the urology team early on is that they can look at the different options for the patients, whether they are catheters, whether a catheter is not needed, or whether there is a suitable procedure that would really improve that patient's quality of life. They can review generally the patient's well-being, consider alternative treatments, as I said. You also have a really key point here, which is that you are dealing with people who have experience of catheters, who have seen many case studies. I did a lot of work around penile cancer in a former role, and one of the things that we used to say to patients is when you are in a penile cancer super network, you're working with people who have seen so many cases of penile cancer, and it really is transformative in terms of you as a patient and what your options might be. And I think that's really key here. You're going to be seeing a team who understands patient needs and can really use their expertise to help the patient. And one of the things I would say is try and involve the patient's family and their carers in the process. That's really key. They are key to the management of UTIs. So I tried to get the takeaways down to 3, and I'm afraid I failed abysmally on this. So out of these key takeaways, out of the 7 key takeaways here, I have to say hygiene, hygiene, hygiene. That is the top one. Make sure that, particularly in a community setting or in the hospital setting, good hygiene is actually followed. And make sure that patients understand the importance of good hygiene. Be on the lookout for symptoms. It can be really challenging in older patients with dementia, but do be on the lookout for symptoms and act quickly. Make sure there's no kinks in a tube, so all part of that, making sure there's no blockage in the catheter, making sure no kinks in the tube is really important. Change or remove the catheter where you can in lines with good practice. So really, I think, those takeaways, and I'm happy to share the presentation after today, but those takeaways are really actually key. And the simple answer to the question I ask is yes, urologists and the urology team should really be involved early on. There's lots of work that has been done around reducing infection and preventing infection. Really great progress has been made in recent years. However, there is still an important role for the urologist in supporting patients and in reviewing the catheters that they have. That's me, that's Urology Foundation. As I said, very happy to share the presentation, and I hope you've taken away some just practical tips for today, which you can take back into your setting. Thank you.